This week, NBC News and MSNBC are collaborating with USA Today to highlight issues surrounding children and mental health. It's a really special and really important series we're calling Kids Under Pressure. And we're starting with new reporting that the nation's medical system does not have enough resources to meet the demand for teen mental health services. That's because the demand for that kind of thing is skyrocketing as more and more teenagers struggle with severe depression and anxiety. 21 states have a severe shortage of child and adolescent psychiatrists. It's a situation that sometimes forces parents to drive for hours to get their child treatment when it becomes available. I'm joined now by Jane O'Donnell, a healthcare policy reporter for USA Today, who is the byline behind that critical story. Jane, thank you so much for coming on.
Sure, my pleasure.
So let's talk about some of this, because the rate of people, teenagers, right, defined as 10 to 19, who died by suicide went up 56% in the years between 2007 and 2016. And by the way, those are the last years that we have data available for. Beyond, obviously, the personal toll here, what are the impacts of this crisis?
Well, there's a very serious financial cost. Even if you were callous enough to say you don't care about the kids, these young people's mental health issues, if left untreated or unaddressed, they are going to turn into physical health issues. Let's set aside for a second addiction and all of that, but it's going to lead, the trauma that so many of these young people have been through is going to affect their physical health. It's going to lead to more autoimmune diseases, cancer, obesity, but then so many of them are going to self-medicate with addiction. There's going to be lost work years. It really is a crisis.
What did you hear from the parents that you talked to?
That it's just heartbreaking because the trauma doesn't stop when you get the diagnosis. It's almost impossible to get treatment quickly. And I'm talking about where we are in this area. I live in McLean, Virginia. Yeah. It's an affluent community. You have people that have to drive hours in the middle of the night to find an inpatient psych bed for a child. Many people have to fly their kids across the country for like a group residential treatment. In Washington, D.C., forget it. If you're on Medicaid, you're not going to get a psychiatrist. It could take months.
There's an NBC News, as part of Kids Under Pressure, this series, we conducted with SurveyMonkey a poll at finding that 29% of parents who took the survey said they thought social media is what contributed the most to mental or emotional health issues in kids. That's above bullying, right? 25% say bullying is part of it. And it seems to be a sign of how the landscape for kids has changed. 10 years ago, bullying was probably right at the top.
Mm-hmm. It was, and I suspect there's some crossover in some of it's cyberbullying, but I think everything is magnified now by social media, and it's been talked about a lot. The old thing about, you feel left out, maybe you and I were young people, it was different where you didn't know you missed the party.
Right.
But there's such an obsession with looks. There's also, it's also creating loneliness. There's a lot of research showing that these kids who have 3,000, 5,000 friends in social media, they don't really have people they can spend time with. And I'd like to just mention quickly that with the suicide rate going up for both white and black teens, the rate is increasing much more quickly for black teens. There's a situation where so many young people are reaching out on social media saying they're suicidal or almost competing to be more depressed. Some are, some aren't, who knows, but it's being ignored.
So what then are the solutions? We've talked about the problems, the impact, the crisis this healthcare shortfall has been dealing with. What needs to be done from a bigger level, a governmental level, let's say, to be able to address it?
The most important thing, according to it's called SAMHSA, it's part of the Department of Health and Human Services. They deal with mental health and addiction. They really want, and they are working on training more pediatricians to be able to treat, diagnose, and refer to psychologists and psychiatrists. So if more people, adults and children, got diagnosed, got mental health assessments during primary care visits, they'd be in much better shape.
Jane O'Donnell from USA Today. Jane, thank you so much for coming on. I urge folks to read your story. We also want to note that if you're struggling with thoughts of suicide, here's the number to call, the National Suicide Prevention Lifeline, 1-800-273-TALK. You can also text TALK to 741-741.